let's start with nucleotide synthesis. See, in order for us to know nucleotide synthesis, we should have known amino acids briefly. Okay, there are 5 nucleotides, correct? I love it. Please.
To know 3 of the
Inhibitors?
I found sure that I have the right ones, the 3 that you told us. Phenolzine, isocarboxyl, and tranoxide.
That's correct.
That's how we should do.
Phenolzine is the one that's usually used. Okay. Any other question? No question. Okay. Yeah. Oh, did you guys get your grades back? During the break, can you remind me? I'll put this name to yeah. Okay. We will learn soon. We'll learn that there is a pathway from carbohydrate pathway that gives you ribose 5-phosphate. Okay, so ribose. Can you guys see that? I can't. It was a different pen. Ribose 5-phosphate. Ribose sugar. This sugar is 5-carbon sugar. So let's just do the. Maybe I should just give the prerequisite first, then I'll give you the whole cycle. Ribose sugar look like this. Have you seen this sugar before?
Yes.
Yeah. At this position it should have OH. At this position it should have OH. Here it should have OH. And then here it should have OH. Okay. That's ribose sugar. But what do you get from pentose phosphate shunt pathway, which you will learn soon anyways? Okay, we'll start with carbs. The sugar of DNA or RNA comes from where? Carbohydrate metabolism. The sugar comes from sugar. But do you know that nucleotide is made of what? 3 components. Phosphate and nitrogen base. So the sugar we're talking about, sugar comes from where? From the sugar pathway known as pentose phosphate shunt. We will learn. We will have to spend a lot of time on that because there's a huge disease associated with that pathway. But what we get from there is a ribose 5-phosphate. What is this carbon? What number is this carbon?
1.
And this one?
2.
And this one?
3.
And this one?
4.
And this one?
5.
So the phosphate is attached to what carbon? 5th. So you're going to call it ribose 5-phosphate. This sugar called ribose has phosphate at position 5. Okay, this is needed for DNA and RNA synthesis. As a matter of fact, all nucleotides are made in the form of RNA first. And then they are reduced and the oxygen is removed. Okay, by nucleotide reductase. Oxygen, yeah. So after the nucleotide is made, okay, so I'm just going to show you something quickly. After the nucleotide is completely made, let's say it's made already, then right here this O is removed and instead hydrogen is left by who? Nucleotide reductase, the enzyme nucleotide reductase. So nucleotide reductase converts RNA nucleotide to what? DNA nucleotide. So first RNA nucleotides are made because sugar already comes in this shape with OH. To make it deoxy, you have to remove the oxygen. Make sense? Okay. So that's one thing. Now, let's start with the cycle. I mean, in your book you have a cycle with pictures, but I thought I should give you something more comprehensive so that can give you overall a good picture. So, ribose 5-phosphate. Okay, so this sugar has to be converted first to the most active form, which can be used for addition of nitrogen base. It already has a phosphate. So this is already sugar and phosphate. The only thing we're missing is what? Nitrogen base. Nitrogen base. So in order to do that, we have to activate this. And we will add to it pyrophosphate. Pyrophosphate. Pyrophosphate is 2 phosphate attached at the same time to each other. 2 phosphate. A pair of phosphate. Okay, that's pyrophosphate. So and there should be an enzyme here And this enzyme is very important. I'll label it 1. Is in your book labeled 1? I think so, I'm not sure. So let's call it phospho. So it will, when you add 2 phosphate to this, it will become phospho ribosal pyrophosphate. Okay. See, ribose 5-phosphate is also phosphoribosal group. Same thing. Now, to add 2 more phosphate to it, the product will be phospho P ribosal R pyrophosphate PP. Okay, and the enzyme should be PRPP synthase. Now, see, the name is too long, so we'll start using PRPP from now on, if it's okay with you. Otherwise, call you lawyers. We can make some contracts. You know, that's what they said in contracts. A long name, they'll say, shall be known this.
Shall be henceforth known as.
Yeah. Okay, so enzyme number 1 requires ATP. Of course, it's the rate limiting step. It's the rate limiting step. It's the slowest step. Okay. So once we have PRPP, let me see what PRPP look like. Look, ribose 5-phosphate. I like to do the whole cycle first, and then I come to these little things. I don't know why I keep going back and forth. It just makes life much easier. This is what ribose 5-phosphate look like. Good. Now you will add the pyrophosphate at position 1 over here. Why would you want to add pyrophosphate at position 1? To make it more reactive, so it can actually attach to what? Nitrogen base. For every reaction to occur, there must be an area that's high in energy, otherwise the reaction will not occur. So you have to activate that area, position 1, because only at position 1 you add nitrogen base, correct? Okay, so now this is active pyrophosphate plus ribose phosphate sugar. So you will call it, look, the first P, phospho, and then the whole sugar is ribose, R, and then in blue, pyrophosphate. Okay. To make phosphoribosal pyrophosphate, we need ATP. It's a rate limiting step. It's the slowest step. It's the most important step in terms of nucleotide synthesis. Now, you can make nucleotide in 2 different ways. One is from scratch, de novo, from scratch, new. And you can make them, actually, you already have nitrogen bases in your diet, and you just combine them to a sugar. Okay. For both of them, you need this pathway. Doesn't matter. You need phosphoribosal pyrophosphate. So this is the most important step of nucleotide synthesis. Without it, you cannot make nucleotide, period. Without it, you cannot make. Okay. Let's take this one aside. Okay, so are we okay so far? I'm gonna go slower. It's okay, we have time.
What was number 1 again? First step?
Oh, PRPP synthase. Okay. So this enzyme produces what? PRPP from R5P, or ribose 5-phosphate. Okay. Now the thing is, we have 2 groups of nucleotide, purines and pyrimidines. Purines and pyrimidines. Okay. Let's start with purines. Purine nucleotide, the backbone of purine nucleotide is something known as inositol monophosphate, IMP. Inositol monophosphate, or inositol. Okay. All right. The difference is, for example, you can go this way, and you will make uridine monophosphate. So the uracil is made first. This is pyrimidine, this side. This side is pyrimidine. Okay. You see, we need to add, it's just a sugar. For this sugar, we have to add a single ring. A single ring is what pyrimidines are made of, correct? As long as we add this ring to this sugar, then that means we have done our job. Let's see. Let me see if I can bring this back, make some space. So let's say here is the single new ring nitrogen base. Okay. this would attach, and then you will remove the pyrophosphate. Phosphate, look, by now you should know that why is ATP used for energy, because it's a high energy compound, and pyrophosphate is the same one. So all phosphate group gives you a lot of energy. We just made a UMP. Simply we added what? The orotate ring. I haven't gone there how you make that. Okay, so that's the end product. This is what it is, this one, UMP. We want to get to that point. How do we make that? Here we want to add a double ring to the same sugar. Okay, purines or inositol monophosphate is double ring, UMP single ring. Okay, now how there's a slight difference. The single ring is made first. It's made first separately, and then it's added on. Please remember that. The single ring, which is orotate, the orotate ring or orotic acid, is made separately, and then the ring is, when the ring is complete, it's added on the sugar. But when it comes to IMP, the ring is actually built on the sugar. It's built on the sugar. It's not completed first, and I'll tell you how it's done. Okay. So between purine and pyrimidine nucleotide synthesis, there's one difference. Pyrimidines are made first. The nitrogen base is made first, the ring, and then it's added on the sugar. When it comes to purine nucleotide or inositol monophosphate, the ring is actually built on the sugar from scratch. You don't complete the ring and then you transport it. No. Okay. So therefore, we will see this. Now, I don't care if you know the steps between PRPP and IMP. Okay, there's about 4 or 5 steps. First, glutamine comes. Glutamine. I'll put GLU. Glutamine comes, so if it's the same sugar, let me bring it to this side. So this is ribosyl pyrophosphate. What glutamine does, it donates its nitrogen. Okay. And then glycine will come. Second step. Glycine, and it will add its carbons. Okay. And then further, a methyl group will come from tetrahydrofolate. I don't care if you know these steps, honestly. It doesn't, as long as you know. And then eventually aspartate. And then finally, again, one more time, tetrahydrofolate. The thing that I care for the most is, if you remember these amino acids, glycine, glutamate, and aspartate are being used to make what? Purine ring. It's a great idea. Okay, if you can remember the amino acid. So let's color these amino acids. Glutamine, glycine, and then aspartate. Glutamine and aspartate only donates their nitrogen. Glycine, the whole glycine is consumed. Okay? Whether you know the detail I'm telling you or you don't, nobody cares, because it would not help you much. What I want you to memorize one thing, and one thing for sure. You cannot ignore that. Tetrahydrofolate. You can't ignore that. What is tetrahydrofolate? Do you remember that? Methyl carrier. Beautiful, beautiful. Therefore, if you have folate deficiency and B12 deficiency, the methyl cannot be transported to here, right? Tetrahydrofolate requires folate and B12. Therefore, you know that nucleotide synthesis, at least for now, purine synthesis, 100% depends on what? Tetrahydrofolate or B12 and folate. Okay? So this is why folate and B12 deficiency can lead to anemias. Because those RBCs that are frequently able to produce, divide, they always would need what? DNA. Every day you produce new RBCs and WBCs, and they need DNA. You might think, why would RBC need DNA? Because eventually it becomes empty sac. But to get to that point, it needs it, because it needs to mix its enzymes and all that stuff first. But it only lives a few days, right? Then it dies. Same thing with white blood cells. They're high turnover cells. They have increased rate of mitosis. Therefore, they need DNA always. Without DNA, division cannot occur. You know that mitosis will not go through. If there is a DNA damage, you know that retinoblastoma gene or product and p53 will block the cell cycle from continuing. Okay, we'll discuss that cancer part of it, but just know that cells have breakpoints, security guards. If there's a mistake in DNA, it will not allow a cell to divide, because the idea is, why would you want to give mutated DNA to your children? In terms of evolution, it's a bad idea. So you're supposed to have healthier and healthier children, or for your cells, they're supposed to have the next. If a cell wants to divide and it gives you new cells, they better be healthy, at least better than before, if not at least equivalent of before healthy cells. As soon as there's a mistake in DNA, it means what? There's a problem, and you don't want to pass that on to the next cells. Okay, so now, so the ring is made on the sugar. It's built on the sugar. But what's used? Tetrahydrofolate, the most important thing. Aspartate only donates to nitrogen. Glutamate only donates to nitrogen, but then glycine will be consumed entirely. Okay? Alright. Okay, so here, let's come to this other side. Let's come to this side. Now, how do you make orotic ring? Well, first, nitrogen, again from glutamine. Okay, or in this case ammonia, plus what's the next one? Carbon dioxide are combined. Where's Nina? Because she was telling me there is carbomoyl phosphate synthase too, right?
Yeah.
She told us that. She's right. This will give you what? Carbomoyl phosphate. But this carbomoyl phosphate is synthesized in the cytoplasm. The enzyme that you have here is carbomoyl phosphate synthase 2. In mitochondria, you have carbomoyl phosphate synthase 1. It's the same enzyme, just with different affinity for nitrogen and carbon dioxide. And carbomoyl phosphate is then further combined with aspartate. If you really think about it, is there any difference between nucleotide and amino acid? Not much. The difference is that nucleotides are a combination of sugar and amino acids. So when you break them down, you will also get carbon dioxide plus ammonia. Okay. Alright, so, and this will give you orotate. Orotate is this ring, the single ring. Okay, this is orotate. Okay, when you combine this ring with a sugar, it becomes UMP. Okay, and let's say we combine this here. So here there's one enzyme. Let's label it 2. This you should memorize. Let's call it POT. Phosphoribosal pyrophosphate P stands for that. O for orotate, T for transferase. P stands for PRPP. O for orotate, T for transferase.
So
Phosphoribosal pyrophosphate orotate transferase.
So the whole name.
Yeah. PRPP and orotate are combined, correct?
Yeah.
Okay, so P stands for PRPP, O for orotate, T for transferase.
That's wrong.
Yeah. We will have no room, at least on this screen. Okay. So at the end of the day, remember that orotate ring is made first, and then it's attached to the sugar, whereas purine ring or inositol ring is built on the sugar. Okay. Now, sometimes you can have orotic aciduria. That means in cases of if there's a problem in the urea cycle, or you have too much nucleotide synthesis, because both of them can give you a lot of carbomoyl phosphate. So urea cycle problems. Urea cycle problems, meaning not the first enzyme. Any enzyme after carboxyl phosphate. Any enzyme after carboxyl phosphate. I'll come back to it, so ask me this question if you don't get it. Any enzyme, so you should imagine that ring of urea cycle, the whole cycle. Any enzyme after carboxyl phosphate, if it's deficient, it will lead to buildup of what? Carboxyl phosphate. And carboxyl phosphate can leak into the cytoplasm. If it leaks to the cytoplasm from mitochondria, that means nucleotide synthesis will increase in that case. At least pyrimidine nucleotide. And sometimes it can lead to orotate being too much in urine. So we excrete a lot of orotic acid in urine. And it will be called orotic aciduria. Okay, we'll talk about it. Yeah. Okay, so we'll talk about it. Just keep in mind that just in case, if there is any enzyme of the urea cycle after carboxyl phosphate, as long as it's not carboxyl phosphate synthase 1 that's deficient, any other enzyme in the urea cycle will lead to orotic aciduria. Make sense? Okay, let me show you the ring. Look, in the urea cycle we have nitrogen or ammonia plus carbon dioxide. They're combined to give you what? Carboxyl phosphate. That's when the ring will start. From there the cycle starts, if you remember that. Here is carboxyl phosphate, ornithine, transcarbamylase, enzyme number 1. Enzyme number 2, what do you have? Arginosuccinate synthase, and then you have arginosuccinate lyase, and then you have arginase. Any of these and 4, if it's deficient, will lead to what? Increase in carboxyl phosphate, correct? Because it's going to build up. And this can leak out of the mitochondria and be converted to what? To orotate. It cannot be converted to orotate or orotic acid in the mitochondria. Okay, only in the cytoplasm. Anyways, I'll come back to this. Just keep in mind for now. Because when we talk about the condition, it'll be easier. Okay. Next thing is IMP can become 2 things, right? What are pure nucleotides? A and G. I thought you say OMG. Okay. Now, in this case, if you add ATP to it, it will become, okay, so it's changed such that you add ATP and then and a hydrogen, it becomes GMP. So you can make a GMP or AMP. Okay? Yeah, so it requires energy, and then you add, so for example, GMP, what is the shape of, we should remember this. This is a double ring, right? So let's say one double ring is, so let's say this is A and this is G. Adenine or guanine, correct? How do you differentiate between them? Okay, all of them should have nitrogen in this position, right? At this position, who would have O and who will have nitrogen? Good. Alphabetically, N comes before. Okay, so you will do that. Okay. So here, in this case, if you want to make GMP which has O, that means you have to use ATP. I don't care for it if you remember this. Not necessarily water. Dehydrogenase, so which means NAD, NAD plus. So that will remove the I will add a hydrogen to it, and this will become, for example, I will remove the hydrogen from water. Yeah. So it will remove the hydrogen from water, and then the O will be added to this position. Okay. For this case, you will have to add what? An amino group. Yeah. Yeah. Okay. Yeah. Okay. And the nitrogen comes from aspartate, if you want to know, but I don't care for it. As I said, this is the enzyme. The enzyme that you're supposed to memorize is number 1 and number 2. Beyond that, we don't care for it. Okay? Because there's too many steps in there, and it's not your job. Okay. UMP. Okay, so we're done with this point. We made GMP, which can be used as guanine nucleotide, but this is still RNA though. Remember that this is still RNA. It's not deoxy. So all of these nucleotides. Let's make these ones first. So UMP can be used to make what? UTP. Okay. UTP and TMP. Sorry, UMP. Yeah, you can use UTP, and then UTP is used to cytosine. I'll just keep it simple. This can be converted to UCP, CMP, sorry, and then TMP. So we got all three nucleotides. This can be converted to uracil, and this can be converted to what? Thiamine or thiamidylate, and then cytosine. Okay. All right. Further, you can add ATPs to activate them, but there you go. Now, to make this, here we need a methyl group. So who is needed? Tetrahydrofolate. Okay, tetrahydrofolate. Good. Okay. And then you remember that uracil has the ring, and C should have what? So C should have nitrogen. So you can add an amide here again. Adding amide to U will give you C. Adding a methyl group to that will give you T. If you remember, the first letter of each is used as nucleotide. So we're talking about here uracil. This is technically uracil. This is cytosine. This is thiamine. Here, adenine, guanine. Okay. All nucleotides should have monophosphate at position 5. All nucleotide. What would you call this? Let's see, if you're confused, what would you call this? If you do not understand these letters, GMP and AMP, let's say we have something like this. Very good, that's sugar. Now what do you think? Adenine. Nitrogen. Yeah. Okay, now if I add a phosphate at position 5, what do you think it's now? Nucleotide. But you can call this adenine monophosphate. Okay? Adenine monophosphate. Or you can call adenylate monophosphate. What does ATP stand for? Okay? If I add 2 more phosphate, what is it now? ADP. What is it now? ATP. The same thing can be used for energy, also for nucleotide. Same thing with G. You have GMP, GDP, and GTP. But to add them, you know, to convert them to nucleotides, sometimes to add them you add a 2-phosphate just to activate them so they can react with something else.
You can have more than 3 phosphates on there, right? Or 3 is the limit.
Naturally, there's nothing found like that. It's too unstable. This bond is very reactive and unstable. So 3 is like burning bond. It's like, yeah. 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 Okay. All right. So, do you understand why it's called GMP, AMP, CMP, and TMP, or UMP? Yeah. You can call them those names. That's fine. Okay. So far we succeeded in making what? In making nucleotide. Now this enzyme here is very important. What do you call this? Thiamidylate synthase. What number is that? Number 3? Yeah. Thiamidylate synthase enzyme. You should memorize this enzyme. Thiamidylate. Okay? Because it makes the T nucleotide. And it requires what? Tetrahydrofolate. There's a chemotherapeutic agent known as 5-fluorouracil that inhibits this step. 5-fluorouracil. Which means it is exactly the same thing as uracil. At position 5, instead of having phosphate, what does it have? Fluorine. But it inhibits this enzyme. It blocks it. because the enzyme mistakes it for UMP. Yeah. And when it eats it, it locks in. It can't make anything anymore. So 5-fluorouracil. Remember this chemotherapeutic agent.
You said it requires.
Huh?
What is it?
Tetrahydrofolate. Yeah. The enzyme requires tetrahydrofolate. Okay. But 5-fluorouracil is an inhibitor of this enzyme, thiamidylate synthase. Okay, or T-nucleotide synthase if you can't remember the name. Thiamidylate synthase. Okay. Okay. All chemotherapeutic aging. So what does it do really? It decreases the production of what? Thiamine. But would this affect DNA or RNA? Only DNA, because T is never found in RNA. So this enzyme, this drug would only affect replication. Only affect replication. Okay. Remember, it makes sense, but as I said, unless somebody reminds you, you don't pay attention to that. The mechanism of this medication is only blocking DNA synthesis or replication, DNA replication. So if I give you choices, if I say DNA synthesis, it's correct. If I say DNA replication, it's correct. If I say the S phase of cell cycle, it's correct. If I say DNA duplication, it's correct. Okay? Very good. Okay. Can it eventually prevent mitosis? Of course. That's the whole idea. It prevents cell duplication, cell growth, cell division, mitosis. So any of those, you shouldn't be surprised. As I said, I don't think any of you have problem with understanding things in terms of gaining knowledge, but when it comes to terminology, you don't pay attention to it. It's not a second nature to you right now. You really need to understand the language of medicine to be successful. Because when you read a question, you read it as if you're translating a language. But when you speak the language, you don't have to think about that. It will be much smoother and easier, and you will excel. So start using these terminologies. It will really, really help you. Okay? Okay. So this enzyme you have to memorize, please. Enzyme number 2, you have to memorize. Enzyme number 1, you have to memorize. Okay? On the other side, we don't really care. But precursor for G, guanine, and adenine is what? IMP. Or guanosine, guanylate, and adenylate, IMP. Okay? And for cytosine and thiamine, or thiamidylate, UMP. Okay? These are all single ring. And the precursor to all of them is orotic acid. Orotic acid. Okay, that's orotic acid.
Which is basically the reciprocal.
Yeah, just a small change. I don't know the exact change. Okay, and then inositol monophosphate is double ring, just without the appropriate nitrogen and oxygen at the right position. That's all. Okay, so nucleotide synthesis is not a big deal. But now let's do something else. Let me finish this. You can remember this, right? Let's see if I can minimize it. Okay, no. I'll make it smaller because now we're going to go to some diseases that are associated with this. In order to go to these diseases, we have to know how do you break this nucleotide and get rid of it, clear them out of the body. Okay. Now, guanylate or G is a pure nucleotide, correct? So at the end of the day, we want to get something called from both of them. I'll make it very easy. I know textbooks makes it very complicated. They give you many steps. I'll just give you 2 steps. Not enough room. Let me go back. Apologize. No more apology. Let's do this. Both of them are converted to xanthine. Both of these are converted to xanthine and then to uric acid. You cannot ignore this step. I think on my exam I had 2 questions. One was about recognizing, or maybe 3 if I remember correctly. One was about recognizing the medication, the disease, and the enzymes. Okay. Okay. let's focus on this pathway right now. Okay, this step right here, the enzyme is extremely important right here. Can you guys see that? I'll call it number 7. Number 7 is whose favorite number? Nobody? What's your favorite number, guys? Nobody.
3 sevens.
14. 2 times 4. 2 times 7. Okay. Although there's this enzyme is involved 7. Okay. Okay, so this enzyme will be known as xanthine oxidase. It oxidizes xanthine to what? Uric acid. Xanthine oxidase. Okay. Xanthine oxidase. Okay. Now let's go back with the basic sugar. I mean the basic nucleotide. As far as I remember, it was something like this: phosphate and the nitrogen base, which had 2 rings. Correct? Okay. First thing, you want to remove the phosphate. When you remove the phosphate from this nucleotide, what do you get? Nucleoside. Okay? And the enzyme is known as nucleosidase. Nucleosidase for both. So remove phosphate. Again, I don't care for this step. It's just to give you some understanding, because sometimes if I give you one step and ignore the other 10, you're like, what happened before? What this one? Just to make it simple for you. So nucleosidase, GMP nucleosidase, guanine nucleosidase, and adenine nucleosidase. Does it make sense? So they're both nucleosidase, but for A it will be specific adenine nucleosidase and guanosine nucleosidase. Adenosine nucleosidase, guanosine nucleosidase. Make sense? Okay. Second thing is, so let's remove we remove the phosphate. So we remove the phosphate because we want to break it down. Isn't that breaking it? Let me draw one line here. Up to this point, it was nucleotide synthesis above the green line, correct? Now we want to break them down. Okay, so look, you would need nucleotide to make DNA and RNA. But what if you have too much? You have to break them and clear them and use them. What if you don't have enough energy? Are you going to be concerned about division? Look, when we have lack of energy, those cells that don't have enough energy, they're not going to be concerned about making new cells. They're going to be concerned about themselves surviving. The only time you can reproduce is if you have extra energy to spend to make new babies, right? When you're concerned about surviving yourself, you don't have enough for yourself to eat, you're not going to be concerned about, I mean, you won't even get married. So nobody will marry you. Let's put it simple. If you're homeless, if you have no food, if you're just surviving minute to minute, no, as these days, guys and girls, they don't go for those things. They don't take these chances. You know, back in the days was good, they would do. But anyhow, maybe today it's true as well, but anyhow. So, once you make nucleotide, fine, but you have extra nucleotide, what are you going to do? Use them for energy. Or if you have lack of energy and you ran out of glucose, you have all this DNA sitting, RNA sitting, or nucleotide sitting. What are you going to do with them? Might as well use them for energy so you can survive and search for more, and then you can produce babies. Okay, in terms of evolution, you always have to think survival for you is the most important thing. If you cannot survive, see, if you survive, there's a chance that you will be happy yourself and you are able to reproduce. If you're healthy and you have enough energy, you can search, you can find. I mean, I know some of us, we just think, we don't do anything, right? We get depressed, or that's crazy. But the whole idea is for you to survive one extra day, what? Maybe you'll get a chance. Maybe you'll find a source of food or something. So anyhow, what's this enzyme number 1? I'll just call it number 1 for now. It's the same enzyme, but one is guanosine, the other one is adenosine. Nucleosidase. Excellent. Nucleosidase. Nucleosidase remove what? A phosphate. It will produce nucleoside at the end. From nucleotide, you'll get what? Nucleoside. Then there's the second enzyme. The second enzyme for both. Now, maybe we should break the bond between sugar and what? And nitrogen base. And let's do that. So we're going step by step. Let's remove that. We just remove the nitrogen base and the sugar. Separate them. And you call this phosphorylase. The enzyme is known as what? Phosphorylase. Okay. And then of course phosphorylase will release ribose, or just ribose sugar, so it has no phosphate attached to, just ribose, or ribose 5-phosphate. Okay, the ribose is a sugar, you can use it for sugar. There you go. The whole idea of breaking down nucleotide is what? To get sugar so you can use it for energy. So you can use that sugar or ribose for energy. The source of this ribose was what? Glucose. And now you can convert it back to glucose so you can use it for energy, especially the brain. Okay. Phosphorylase. Number 2 is phosphorylase. But of course you will call it guanosine phosphorylase or guanine phosphorylase, and A will be adenine phosphorylase.
Isn't the phosphate already removed?
Yeah, but now to remove the sugar you add a phosphate just to break them. Yeah. Okay.
I can replace it.
Yeah.
Different.
Yeah. So again, ribose is released. Now what are we getting? Here we're getting actually G, just G, guanine, and here we're getting adenine. Good. But they have, now what we're going to do, the next step is to remove the amino group or release ammonia. And what would you call an enzyme that removes ammonia? Deaminase. Very good. Deaminase. Deaminase. Now there's the fourth step. I don't care for it. Okay, so just ignore the fourth step. Let's not make life complicated. Okay, and then you will get xanthine. Once you get xanthine from both, xanthine is then converted with xanthine oxidase to uric acid. Uric acid is toxic to your body. It's organic acid. The whole one of the major idea of the kidney is what? To remove toxic substances from blood and from the body. So uric acid should be cleared by the kidney. Okay, so it's toxic. It's insoluble. If it deposits in tissue, it will precipitate, crystallize. Okay. Now we can talk about the disease called gout. Now there is if uric acid crystallizes, it can lead to a disease or condition called gout. Okay, it will lead to gout. How would you be able to produce gout? Well, there has to be too much uric acid. It's usually hyperuricemia. Hyperuricemia. Abnormal production of uric acid or inability to remove uric acid. And anyway, it's the same thing. Overproduction of uric acid or inability to remove uric acid. So if we have kidney problem, it can lead to hyperuricemia. That's one way. Or we can produce too much uric acid, overproduction. By far the most common cause of hyperuricemia is not renal failure. It is overproduction of uric acid. Overproduction of uric acid. Okay? Now, and that will lead to gout. Are we okay with gout? So let me tell you the symptoms of gout quickly over here. Gout. And then I'll take a break. We'll come back to the other side. Gout. In gout, the underlying gout is hyperuricemia. Hyper means increase. Does it mean increase?
Yes.
It means abnormally increase, not just increase. Increase above the normal range. Abnormally increase. Toxically increase, if you want to call it that way. And what is uric acid? Semia in blood, or emia in blood. Uric, so it will be uric and then emia in blood. So increase, abnormal increase of uric acid in blood. That's what it means. Okay, so if you have too much of this will crystallize. It will crystallize. When it crystallizes, what is the crystallized form called? There you go. Sodium, uric acid combines together. Uric acid is negative, sodium is positive. Okay, monosodium urate crystals. Okay, now these crystallized forms can deposit in tissue. They will deposit in tissues, especially joints. They'll deposit in joints. Okay, so these crystals will deposit where? In joints. And let's memorize these joints because it's not all joints. The most common joints are your toe, great toe, the bigger toe, plus ankle. Is ankle joint located in the upper, the left arm or the right arm?
The ear.
The ear. Okay.
That's a good question.
Okay.
Take him off guard, huh?
So if you really focus, gout primarily affects lower extremities, especially the great toe. Yeah. And due to gravity, it goes in blood most likely to those areas. Deposit of these are called trophies. Trophy.
There's a candy called toffee.
That's what it looks like. It's a dark chocolate-like crystallized. Yeah. I love caramel. Oh my God. Now, so what happens is, look, is this sudden onset or is it slowly progressive? Sudden onset. The person will have sudden onset of pain. Sudden onset of pain. So gout is monoarthropathy. Monoarthropathy. Write it down. I know you're going to forget. Monoarthropathy. Usually it involves a single joint. Gout is monoarthropathy. Monoarthropathy. Usually it involves a single joint. Okay, and the most common joints are ankle and toe, the big toe. And the toe or ankle will be red, swollen. It's inflammation. Remember, it's inflammation of these joints. Let me tell you what the ankle and big toe would look like. It'd be red. It'd be swollen. It would be tender. What does tender mean? Very good. It will be sensitive to touch. It will hurt. Okay. Now it will be warm to touch because there's increased blood flow. Huh? It is inflammation. Yeah. It's acute inflammation. Acute inflammation. It's very painful. Remember that it is usually a single joint. Usually a single joint. It's not bilateral. Okay. Sudden onset. Now, people who are at risk are those people who somehow have a huge production of pure nucleotide, or you cannot consume pure nucleotide. King's disease? King's disease. Yeah. That's true. Red meat can increase the symptoms or the risk of gout. Red meat, red wine. Okay, and leukemic patient. Why leukemia? See, leukemia is a cancer of white blood cells, correct? Okay. Now these white blood cells, they're produced at such a high rate that your blood, first of all, they're not functional, and second of all, they accumulate in blood. But they're also killed. The lifespan of white blood cells is not long, right? So they're killed, and it's known as tumor lysis syndrome. And white blood cells are full of what? DNAs, RNAs. Now, when you have so many white blood cells, they're killed. The amount of nucleotide in plasma or in blood will increase. And of course, pure nucleotide specifically will be converted to what? Xanthine. And xanthine to what? Uric acid. So this is called overproduction of uric acid. Okay, so this is actually cancer origin of gout. But now we can talk about other things. We can talk about something other than that. So, first of all, I have to discuss the cause of gout, the medication of gout. Let's go with the cause of gout. What if you don't have enzyme 1? You can make xanthine. You cannot make PRPP. Okay, so this path was if you want to make nucleotides from scratch.
Oh, in the beginning. Okay.
Yeah.
Sorry, I was looking at one.
Yeah.
Second part.
Oh, never mind, sorry. Let's ignore this one. Make it 11. 12, 13. Okay. Now look, guys. So there are two ways to make nucleotides. One is from scratch. We just discussed it, from scratch. But from your diet, when you eat diet, you would already have these rings. You get these rings from where? From your diet. Okay? You get it from your diet. The first one we discussed, all of this is from scratch, de novo synthesis. Now we're going to talk about what if you get these rings from your diet. All you need to do is add them to what?
Add them to the middle.
Okay.
Add the-
Which is
add
P?
13.
R, PP, that's all you need. So you can add the ring to PRPP. All of them. Let's say this is A. Let's say this is G. Okay? And then pyrimidines don't cause gout, so we don't have to worry about them. But nonetheless, they can also be added to what? PRPP. Okay? So PRPP. The enzyme, let's put it this way. Enzyme here, 1 for A, I'll call it A. Enzyme A has a name. Enzyme G has a name. And enzyme, let's say this is C, has a name. Okay? What would you call an enzyme that adds adenine to PRPP?
PAT.
Phosphoribosal adenine transferase. Okay? Or you can call it adenine phosphoribosal transferase. That's all. This enzyme combines adenine, which is a nitrogen base. Adenosine is a not nitrogen base. Adenosine is what? Sugar and phosphate. Okay? Sugar and nitrogen base without phosphate. Adenylate is a nucleotide. Okay, so when you say adenine, let me just give you some terminology. Adenine is just a nitrogen base, just this double ring corresponding to A. That's adenine. Adenosine is if you have this attached to sugar. So the ribose sugar plus the double ring, this is called adenosine. Adenylate is a full nucleotide. Adenylate is, it has a phosphate and then a sugar and then a nitrogen base. Adenylate has all three components of nucleotide. Adenosine does not have phosphate. It's the sugar and nitrogen base attached. Adenine is only the nitrogen base. Guanine, only the nitrogen base. Thymine, only the nitrogen base, for example. Or thymidine. Okay? Alright. So if you're adding adenine to phosphoribose pyrophosphate, we'll call it adenine phosphoribosal transferase. That's all. That's all. Because the pyrophosphate is removed in this process, right? When you add them, this is removed and replaced with what? With adenine. That's why you will call it PR, adenosine or adenine transferase. Yeah, you can call it APRT or PRAT. Doesn't matter. Yeah. Okay. Same thing with guanine. Okay. Guanidine. What are you going to call it? Not guanosine, because it's not sugar and yeah. So you can call it guanine phosphoribosal transferase. Okay. Same thing with cytosine phosphoribosal transferase. Not adenosine, yeah. Okay. Okay. Now these are this pathway is when you get these adenine, guanine, and so forth from your diet and you add them. What if you have deficiency of these two enzymes? Can you ever combine the two? No. That means what? You have accumulation of what? These nitrogen bases, purine nitrogen bases. You have too much nitrogen bases. What are you going to do with them? Break them. And that leads to what? Too much uric acid production. So PRPP, let's just say this, I like the other way. Yeah. PRAT deficiency or PR, that's no good. G, see, guanine and xanthine have the same enzyme, so sometimes it's called GHPRT, okay, or HGPRT, doesn't matter how you call it.
What is this then?
So guanine hypoxanthine phosphoribosal transferase. Okay. Okay. Hypoxanthine is the same thing as inositol, pretty much. Okay. So you have deficiency of these enzymes, you will have also gout, but that's genetic part of gout. Okay, it's known as Lesch-Nyhan syndrome. Let me write this down. So look, one, we can have gout if you have tumor lysis syndrome, correct? Or the kidneys cannot clear uric acid from blood, correct? But there's genetic component. The genetic component is if there's an enzyme deficiency. An enzyme deficiency. And that is, I don't want to erase this picture. So genetic causes of gout. If you have PRAT deficiency. Good? Similarly, GPRT deficiency, either for adenine or guanine, doesn't matter, because they're both pure nucleotide. They're both converted to xanthine. You can have also PP deficiency, synthase deficiency. In any case, you're not able to consume adenine or guanine. If you cannot consume it, what happens? It would accumulate.
Sorry, why is PRPP synthase part of this? Isn't that
Okay.
early?
Yeah, let me go back. Good. Very good question. I thought nobody would ask. Okay. So we need ribose 5-phosphate, and we have to convert this to what? PRPP. And then let's say this is PRPP. See, okay. How am I gonna do this?
Oh, I get it.
You get it, but some other people didn't get it. Yeah, I have to. I know. And then we have, this is PRPP. Okay. Now you need to add the purine nucleotides or the purine based nitrogen bases to this, right?
Yeah. So if you don't have that, you can't.
If you don't have this, how are you going to add it? It would accumulate, correct? Or you have the sugar, no problem, but you don't have the enzyme that adds the two. Okay? So at the end of the day, whether you have PRPP synthase deficiency, which is genetic, so PRPP deficiency as an enzyme, or guanine, adenine, phosphoribosal transferase together, one of them. Deficient, same thing. Yeah. Okay, so that should be E right here, I think. This should be E. Syndrome. Okay, so look for this. When this is genetic gout, but they will also have other symptoms. So they will have self-mutilation. This patient will have episodes of gout, but also self-mutilation. They start biting their nails, their fingers, or whatever. They start hurting themselves. Self-mutilation, mental retardation, and gout. Have those three, you should think of this. Mental retardation, self-mutilation, and gout. That's when you have Lesch-Nyhan syndrome. Okay? Alright. So this is the major disease associated with gout. With pure nucleotide catabolism is what? Gout. Or nucleotide synthesis is what? Gout. Nucleotide synthesis at which position? Position 1 will lead to gout. If this enzyme is deficient, it will lead to gout. But also if you have the other pathway where you combine PRPP with the already synthesized nitrogen bases, it will lead to gout. So look for those things. Okay. Increasing activity of xanthine oxidase. Could that lead to gout? Yeah. So we have medication. There is a medication known as allopurinol. This medication inhibits what? Xanthine oxidase. Okay, it inhibits xanthine oxidase. Please memorize this medication. Xanthine oxidase, allopurinol. This medication inhibits xanthine oxidase. Would it help gout patient? How?
Decrease uric acid.
If I'm in painful crisis when I'm having gout and I say, oh, I have pain, would you give me this medication? Why not?
It just prevents
Does it prevent it from increasing?
Yeah, this can only prevent the attack. Very good. Allopurinol is only used for prevention, not for treatment of symptoms. It won't help you.
Not for pain.
Yeah, good job.
Isn't that like alcohol based?
It is. Yeah, very good.
Even though I don't know what the answer.
Now, if you get confused, think about it. This drug inhibits the breakdown of all purines. Look at the name, it's such a beautiful name. All purinols. All purine are inhibited. Out loud, but they don't have LOL. Okay, all purine are breakdown is inhibited by this enzyme. So it will only help in prevention of gout. Only in prevention of gout. So if a patient has a history of gout or they have genetic gout, one of those enzyme deficiencies, and they're expected to go eat some red meat or whatever, maybe you have to think about giving this medication. But who knows? They should diet actually. It's much better. Okay, but gout, the exact disease or the exact condition is infection. Inflammation, and the inflammatory cells that are most important for gout are neutrophils. It's neutrophil that leads to inflammation in this joint and cause pain. So we can use medication that will decrease recruitment of neutrophil to the site of inflammation. Yeah. So we talk about one medication. As I told you, on gout I had 3 questions, and I'm sure you'll have one at least. Such a big deal. So one medication we can use is that will inhibit neutrophil migration to that site of injury. And the injury is caused by what? Crystals of monosodium urate. Okay, or uric acid crystals. So is there any medication that you can think of that will decrease the recruitment of? NSAIDs. Don't forget them. Acetaminophen. Yeah. There you go. NSAIDs, they inhibit prostaglandin production. Prostaglandin production. You will never be, you should never forget about that whole thing. Again, in lipid synthesis, we'll talk about this. Okay, so NSAID, you can use that. This is the first drug of choice for treatment of gout, not for prevention, treatment of gout. The second drug you can use is known as colchicine. Colchicine?
No, we can't use hormones, steroids.
No. You can use them, yeah. But that will inhibit also leukotrienes. Yeah, you don't want to do that. Yeah.
It's not more effective.
If it's severe, yeah. See, the thing, corticosteroids are not a good drug because they have tremendous side effects. Yeah. It's more effective for inflammation, of course. It's much stronger inflammatory medication. Yeah.
So how does colchicine help here? Doesn't it just inhibit 2D?
Very good. Now we're coming. How does colchicine help you? Do you remember that I talked to you about colchicine during DNA synthesis? Yeah. Yeah. So let me erase allopurinol, right? Are you good with allopurinol? Now, let's say here is neutrophils in blood vessels, okay? They're swimming in blood vessels. These are all blood cells, correct? And then the gout crystals, or I should say uric acid crystals, are causing damage where? In the tissue, which is away from blood vessel. And there's irritation, there's inflammation. So now, neutrophils, they sense this damage, they come out of blood vessels to this site. Okay? Neutrophils will come to the site of injury. And when neutrophil comes, that means fluid will come, and there'll be more white blood cells coming, and that's inflammation, technically. How did it travel from here to here? Is by microtubules. It's almost like having a train on a track. Microtubule serves as a tract or roads. If you remember that day 1 of this class, we talked about microtubules, intermediate filaments, microfilaments. When we talk about microtubules being responsible for transport, movement. All sorts of transport is done by microtubule. So neutrophil, how do they know to get there? They have to walk along these microtubules to go to the exact site of inflammation. Otherwise, they'll be like randomly going everywhere. So if you use colchicine and you block this microtubule formation, neutrophils will never be able to get where? Yeah, to the site of injury. And therefore inflammation will decrease. See, inflammation is nothing more than extravasation, meaning white blood cells leaving out of blood vessels, migration of blood vessels. That's what inflammation is. Inflammation, simply the core of inflammation is migration of white blood cells to the site of injury. You can think of it like in those Hollywood movies when you have in LA 1 million cops coming to one little trauma, whatever, something like that. You know, all of them come in, they block the whole roads and everything, and then it's like swelling. Exactly the same thing. That's inflammation. So neutrophil migration is blocked by who? Colchicine. Neutrophil migration. Okay, that's how. Once inflammation decreases, then you won't have pain, and your body can slowly get rid of it. But you will have to use allopurinol to not produce more. There's another medication, probenecid. Okay.
I have a question. Can colchicine be given locally?
Yeah.
So in this case, this would be best.
Yeah, you can give. So he's saying, can colchicine be injected locally to the tissue? But nonetheless, colchicine is toxic. It can, and so far as I know, I never seen an IV form of it. Okay. Yeah. Colchicine can cause GI problems and can cause death of GI cells and so forth. That's why you don't want to go to that route. The primary use of colchicine should be for metaphase freezing of chromosomes, so you can take a picture of chromosome called karyotyping. That's what the primary purpose of colchicine should be. Not for, but nonetheless, if you have nothing available, you might use it. Yeah. Probenecid is something else. Probenecid increases the excretion of uric acid. Increases excretion. Excretion means out of the body. Out of the body. It increases renal excretion. Renal excretion. It prevents the kidney from reabsorbing uric acid, and it promotes its excretion out of the body. So hopefully it will decrease plasma uric acid. Okay. So as far as I know, we talked about 4 medication when it comes to gout. You should know them.
So for somebody who's having an attack, you would give them an NSAID and prevention?
You could, but NSAID would do the job. Yeah. Okay. Yeah.
Uric acid can be generated in the organism.
Yeah, good question. See, birds, they convert uric acid to solid stool. We don't have any mechanisms to get rid of it except kidneys. It's toxic. You know, when we say something is toxic, that means your body doesn't have the ability to metabolize it and convert to something soluble or non-toxic. We don't have that.
So, can they, for example, make medication to...
I'm sure they can.